We know that circadian rhythm is a rhythm that is natural to the body. So in our research, what we did, sir, is we made the eye open of the mice and then had the ray of sunlight go through the eyes.
Okay.
And we analyze what is happening in the suprachiasmatic nucleus in the brain and then see what kind of activity is there. So then we did two kinds of research. One is eyes wide open, and the other one is completely shut.
Sure.
And we made the mice both ways, during the day and also during at night. During the day, when it is bright out there, when the mice was completely blocked, the hormones were acting as if it was night.
Night, yes.
Isn't it amazing?
Yeah. So, I mean, this is what they call the Zeitgeber, like basically it's the external stimulus that causes the melatonin secretion, wants you to sleep. So that's why we insist that you need sunlight in the morning, you need darkness in the night. And that's what really helps to keep the, vitamin D levels up in the daytime and melatonin levels up in the nighttime. And that really makes a huge difference. Light plays a tremendously important factor in good sleep.
Sleep, yeah. Coming to the light factor, our ancestors didn't have light, so they created fire.
Yes.
My mentor Sachin Panda, he's a circadian rhythm research specialist in San Diego. He always says that human beings are the only species who can make use of a controlled use of fire. All the other species, they can make fire, but they'll not be able to control it.
Yeah.
The controlled use of fire happened because they wanted to do a chat after hunting between the people about the politics, about gossips, and that's how fireside chat came across. But the problem here now in the modern environment is there is no limited availability of fire. It is fire all the time. At night, in the evening. I asked him, so what do you do in this modern environment? So he said that even, for example, this bright light, this is a stimulating factor for your eyes. And that is creating an artificial environment that you are widely active. So what do you recommend your patients of? How do you decrease the usage of lights?
So what we normally recommend is, of course, early dinner, In our country, in India, we say no later than 8 o'clock, but in the US and a lot of the Western culture, we eat by 7 o'clock.
Yes.
So definitely, like eating early and giving at least about 2 to 3 hours before bedtime after that would certainly make a difference. And just as a cutoff time, I always say right after dinner, start using dim lights. So that you are beginning to, expose your body to less light and preparing to sleep. Okay. The next most important thing is all these light emitting gadgets, whether it is TV, whether it is, using your laptops or
computers.
using any of the tablets, computers, any of those emit blue lights. So, I mean, there are a lot of blue light filters and all that are coming. But we say that in general, it's better to avoid any of those at least 1 hour before bedtime. And then do something to unwind. And when I say unwind, it doesn't have to always be meditation. It can be anything. It can be even playing with your children. If that unwinds you, music, reading a book. But when you do any of these, particularly reading a book or any of those, we strongly discourage from doing it while in bed. Just say that, your mind has to connect, saying that the bed is only for sleep or intimacy with your partner, nothing else. And if at all you are reading a book or anything, better to use backlights rather than lights that are directly hitting your eyes. Any of these stimulates the rods and cones, and exactly the melatonin secretion can get affected.
I come to India very often, and I also go to US as well. When we go to the US, usually, as you know, you're also having a hybrid lifestyle. The yellow lights is very common.
Yes.
In India, my mom and dad absolutely hates
the yellow lights. It is very strange. Which lights came first, whether it is India or anywhere? It was yellow lights.
It was yellow light.
Correct. But then, the white lights started coming only later on. I mean, you remember tube lights were a big phenomenon a few years back, few decades back. So definitely things have changed. But now I think, increasingly people are moving back to
yellow lights. Or the other way we can say, sir, is during the day, you can use white lights.
Yes.
And during the night, you can use yellow lights.
Use yellow lights and preferably not directly stimulating your eyes. That's very important.
looking at something.
Yes. Yeah.
And the distance also matters.
Absolutely. Yeah.
The more closer it is, the brighter the intensity.
Correct. And let's face the reality. I mean, the sizes of the homes in India and all that may not even give you too much of a distance for watching television. So, you need to be cautious when you're doing that.
What do you do at your home? Yellow light or white light?
No, we have both. Obviously, every room has both kind
Both,
of. Yes. So we've had a mix. Only because, as you said, sometimes when I'm like working, I prefer a bright light during the daytime. So I might use it. But in the evening, it's absolutely dim yellow lights.
Me as well.
And my wife has been. She's an interior designer and she wants only yellow lights. So it kind of like scientifically I have to agree with her.
I'll make sure my wife doesn't see your wife. Because in the Chennai house, same thing. 2 yellow lights and 2 white lights.
Yes.
We do that. And in the US, the bulb itself changes in color.
Yes.
Right?
So, I mean, those kind of lights are beginning to come in. Intensive care units now can have, light intensity changing during the daytime because a lot of ICU beds don't have windows. So you can change the light to be like sunlight versus. So all those are coming with a lot of fancy lighting.
But that is important, correct?
Yes,
Very
absolutely,
important.
absolutely. So that's why in the ICU, a lot of people can develop what we call ICU delirium or ICU psychosis because they totally lose day-night orientation.
This is a very important point. So, please explain about what is delirium and why it happens in ICU. This is a very important part for the audience.
So delirium, I think the easiest way that most people can relate to is anybody even having a fever, at home, sometimes may say bizarre things or they may not remember what they are saying. They may be confused. Sometimes they may not recognize what's going on. And this may be very brief. Now, when you move patients to a different environment like an ICU. See, intensive care units, there's a lot going on there. We are really caring for very sick, critically ill patients. So there's a lot of noise. There's a lot of lights because of the monitors and everything else that's going on. Alarms keep going on, so the noise can be disturbing to sleep. Plus, you are in an environment where your family sees you very occasionally. So you are seeing strangers, whether it's doctors, nurses, physiotherapists, anybody. So with all this happening, many people can become delirious. So they become confused, particularly common in the elderly. And or those who previously have sleep disturbances or psychological disturbances, mental health illnesses. If they have it, then the chances of delirium is much, much more. In fact, some of the delirium people think may be due to medications that are used as well, but it may be required and we'll have to be cautious on that. Now, when we deal with delirium, we always tell all our trainees and whoever is getting educated, the way to treat that is not by giving more medications. It's not by, doing what we call restraints or, trying to avoid the confusion. It's more to take some time to reorient them, but more importantly, giving them the kind of environment the best possible. You can't change everything in the ICU to see that it is more conducive for sleep. In fact, a lot of ICUs, including ours, have a quiet time in the afternoon where, the alarms may be lower in the volume. And of course, the nurses are there monitoring it and that wouldn't cause any compromise on the patient's safety. We have to be careful about that as well. And, lighting appropriately. And in the night time, see, even little things like the temperature. Somebody may not be used to air condition all through the night, whereas in the ICU, it is air conditioned. So all of those may cause confusion, and it's very, very important to address it, allow family members to be with them so that they can reorient and help.